Hi, my name is Aaron Gerds. I'm an assistant professor of medicine at the Cleveland Clinic Taussig Cancer Institute in Cleveland, Ohio. I'll be discussing today a poster presented here at the ASCO annual meeting on Glasdegib, a hedgehog inhibitor for treatment of patients with myelofibrosis. If we look at the poster here, and beginning with the background, the treatment of myelofibrosis is really centered around inhibiting the JAK-STAT pathway. However, many patients do have persistence of symptoms and spleen size. In addition, JAK inhibitors, although improve patients' quality of life and have some survival advantage in some studies, doesn't necessarily affect the underlying biology that we know of this disease by attacking the malignant clone or reversing the fibrosis. So the smooth and hedgehog pathway is an ideal target to slow down cell proliferation as well as the paracrine effects within the bone marrow stroma. So this was initially an open label cohort study with a plan for a randomization afterwards. However, this is the lead-in portion of that study, the first 21 patients treated with myelofibrosis treated with this compound. If I could direct your attention to Table 1, this outlines these 21 patients. Really, what we expect for is an age and male to female ratio. On average, these patients were 70 years old, a male to female ratio of 13 to 8. Interesting, these patients were heavily pretreated. These are all patients who had previously received a JAK inhibitor. 71% received one previous JAK inhibitor, where 14% of patients received two JAK inhibitors, and 15% of patients received 3 or more JAK inhibitors. So again, very heavily pretreated population. The primary endpoint in the study was, of course, being a phase 1 study, was looking at adverse events and safety outcomes, but also we wanted to look at the proportion of patients that achieved at least a 35% reduction in their spleen volume at week 24, as well as patients that achieved at least a 50% reduction in their total symptom score. So again, an improvement in symptom burden at week 24. There were a number of exploratory endpoints, including patient-reported outcomes, particularly health-related quality of life, as measured by the EORTC QLQ30 questionnaire. If I could then direct your attention to Table 2, this is an outline of the treatment-related adverse events reported in at least 15% of patients. So really a fair number of grade 1 and grade 2. The main symptoms that patients reported, both anecdotally in clinic as well as in whole on the study, were dyschezia and muscle spasms. But otherwise, this medication was pretty well tolerated in this population. Moving on to Figure 2. Figure 2 does show the spleen responses in this population. The line across the middle here at 0 shows no change, and everything above that line is increase in spleen size. Everything below that line is decrease in spleen size, where the dotted line represents a 35% reduction in total spleen volume. By looking at this figure, a fair number of patients did have a reduction in their spleen size, and even a larger proportion of patients had somewhat of a stabilization of their spleen size. Again, these are heavily pretreated patients that had a large spleen and a significant symptom burden while on a JAK inhibitor. And a few patients out here at the far end did have an increase in their spleen size. So overall, a relatively stabilization of spleen size in these patients. Figure 3 shows the symptom burden in these patients at week 24. As you can see, some patients did experience at least a 50% improvement in their symptom burden at week 12 as well as week 24. But even a larger proportion had a symptom reduction of at least 20%, upwards in some domains of 30 to 40%. Figure 4 shows the symptom burden over time in these patients. The blue line representing total symptom score, the red line really identifying a reduction in spleen-related symptoms, green in constitutional symptoms, and showing an overall downtrend in the symptom burden over the course of the study. The right-hand panel of Figure 4 shows the most severe patients, as patients that had the highest scores coming into the study, and even that cohort had an improvement in their symptom burden. So in conclusion, Glasdegib had an acceptable toxicity profile in patients who were with myelofibrosis who were heavily pretreated with JAK inhibitors. The main treatment-related side effects that we saw were dyschezia and muscle spasms. With respect to efficacy, we saw largely a stabilization of spleen size, again in these advanced patients who were heavily pretreated. And we did see some improvement in symptom burden. I think a lot of questions come out of this abstract, mainly focusing on how we measure response in these patients. Perhaps the original ways of measuring symptom response as well as spleen size that we do for patients that are previously untreated do not necessarily apply to this population. Therefore, setting the bar of a 35% reduction in spleen volume or a 50% reduction in total symptom score may not equate with how patients feel on the study. And perhaps stabilization or much more modest improvements in symptom burdens can be meaningful for these patients. Some limitations of this study include, of course, the small number size, small number of patients on the study, as well as the sparse collection of patient-reported outcomes. We did collect patient-reported outcomes, particularly quality of life scales, at the beginning and during the study, but it was difficult to correlate those with changes in symptom burden over the course of the study. Of course, another limitation is the fact that this is a single-arm open-label study, and there may be some placebo effect. However, some anecdotal results from the study suggest that some patients might have an improvement in transfusion burden, which is further being explored in other studies. And again, a number of clinical correlates are being looked at in terms of changes in fibrosis levels and cytokine levels to better understand the role of inhibition of this hedgehog smoothing pathway in the pathogenesis and treatment of myelofibrosis. And future studies looking at combinations of JAK inhibition and the hedgehog pathway smoothing inhibition are currently being investigated. So I'd like to thank you for your attention while reviewing this poster abstract and look forward to speaking with you again.